Let us start with the meaning of mental health. Mental health includes our emotional, psychological, social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. Mental health is important at every stage of life. So just checking my screen is appearing.
Yeah, it's absolutely fine, Doc. You can go ahead with the session.
Okay. So according to WHO, mental health is a state of mental well-being that enables people to cope with the stresses of life and realize their abilities, learn well and work well and contribute to their community. It is an integral component of health and well-being that support our abilities to make decisions, build relationships, and shape the world we live in. Mental health is crucial to personal, community, and socio-economic development. Mental health is more than absence of mental disorders. Mental health involves effective functioning in daily activities, resulting in productive activities like work, school, caregiving, healthy relationships, ability to adapt to changes, and cope with adversity. Okay. Also, mental health wellness, positive mental health allows people to realize their full potential, cope with stresses of life, work productively, make meaningful contributions to their community. Let's talk now about the mental illness. What is the mental illness? Mental illness, also called mental health disorders, refers to a wide range of mental health conditions, disorders that affect your mood, thinking, and behavior. Examples of mental illness include depression, anxiety disorders, schizophrenia, eating disorders, and addictive behaviors over the course of your life, which leads to distress and problems functioning in social work or social life, work, or family activities. There is some factors related to mental health illness, like biological factors such as genes or brain chemistry, life experiences such as trauma or abuse, family history of mental health problems. Mental health problems are common, but help is available. People with mental health problems can get better and many recover completely. So, what are the early warning signs for mental illness? Not sure if you or someone you know is living with mental health problems. Experiencing one or more of the following feelings or behaviors can be an early warning sign of a problem. For example, eating or sleeping too much or too little, pulling away from people and usual activities, having low or no energy, feeling numb or like nothing matters, having unexplained aches and pains, feeling helpless or hopeless, smoking, drinking, or using drugs more than usual, feeling unusually confused, forgetful, on edge, angry, upset, worried, scared, yelling or fighting with family and friends, experiencing severe mood swings that cause problems in relationships, having persistent thoughts and memories, hearing voices or believing things that are not true, thinking of harming yourself or others, inability to perform daily tasks like taking care of your kids, or getting to work or school. Now I wanted to talk about stigma. So many people who have a mental illnesses do not want to talk about it. But mental illness is nothing to be ashamed of. It is a medical condition just like heart disease or diabetes. And the mental health conditions are treatable. We are continually expanding our understanding of how the human brain works, and the treatments now are available to help people successfully manage mental health conditions. Mental illness does not discriminate. It can affect anyone, regardless of your age, gender, geography, income, social status, race, religion, sexual orientation, background, or aspect of cultural identity. While mental illness can occur at any age, 3/4 of all mental illness begin usually by age of 24. So stigma and discrimination can contribute to worsening symptoms and reduced likelihood of getting treatment. A recent extensive review of research found that self-stigma leads to negative effect on recovery among people diagnosed with severe mental illnesses. Effects can include the effects of stigma include reduced hope, lower self-esteem, increased psychiatric symptoms, difficulties with social relationships, reduced likelihood of staying with treatment, and more difficulties at work. A 2017 study involving more than 200 individuals with mental illness over a period of 2 years found that greater self-stigma was associated with poorer recovery from mental illness after 1 or 2 years. So stigma affects the outcome or prognosis or improvement of the mental illness. Some of other harmful effects of stigma can include reluctance to seek help or treatment and less likely to stay with treatment, social isolation, lack of understanding by family, friends, co-worker, few opportunities for work, school, social activities, or trouble finding house, bullying, physical violence, or harassment. Also, health insurance that doesn't adequately cover your mental illness treatment, the belief that you will never succeed at certain challenges or that you can't improve your situation. Research shows that knowing or having contact with someone with mental illness is one of the best ways to reduce stigma. Individuals speaking out and sharing their stories can have a positive effect or impact. Many celebrities, such as Demi Lovato, The Rock, Michael Phelps, Lady Gaga, have publicly shared their stories of mental health challenges and brought the discussion much more into the general media and everyday conversation. Young people are looking for information for these personal stories online, and this is a very positive effect. Sharing celebrities sharing their stories with mental illness, this reduce stigma and make people encourage people to talk without shame about mental illness or mental struggle. False beliefs about mental illness can cause significant problems. Stigma can lead to discrimination. Discrimination may be obvious and direct, such as someone making a negative remark about your mental illness or your treatment, or it might be unintentional, such as someone avoiding you because the person assumes that you could be unstable or violent or dangerous due to your mental illness. You may even judge yourself. So all of these behaviors are wrong. Mental health, overcoming the stigma of mental illness. So how to overcome the stigma of mental illness? There is some points it can help to overcome stigma of mental illness, like talk openly about mental health, such as sharing on social media without shame, educate yourself and others, respond to misperceptions or negative comments by sharing facts and experiences. Be conscious of language. Remind people that words matter. Encourage equality between physical and mental illness. Draw comparison to how they would treat someone with cancer or diabetes, and how they would treat someone with mental illness. So what we wanted to say, it's not less dangerous than cancer or diabetes, or less important. Okay. Show sympathy to those with mental illness. Be honest about treatment. Normalize mental health treatment, just like other healthcare treatment. Choose empowerment over shame. I fight stigma by choosing to live an empowered life. To me, that means owning my life and my story. Train leaders to identify emotional distress and make referrals, and to responding promptly and constructively to behavioral and performance issues. Be welcoming of the need for accommodations. Train managers to respond appropriately. Also, there are some steps to cope with stigma. I think this is a repeated screen. Okay. The other steps also: get treatment. You may be reluctant to admit you need treatment. Don't let the fear of being labeled with a mental illness prevent you from seeking help. Treatment can provide relief by identifying what's wrong and reducing symptoms that interfere with your work and personal life. Don't let stigma create self-doubt and shame. Stigma doesn't just come from others. You may mistakenly believe that your condition is a sign of personal weakness, and this is a mistake belief, or that you should be able to control it without help. Seeking counseling, educating yourself about your condition, and connecting with others who have mental problems can help you gain self-esteem and overcome destructive self-judgment. Don't isolate yourself. If you have a mental illness, you may be reluctant to tell anyone about it. Your family, friends, or members of your community can offer you support if they know about your mental illness. Reach out to people you trust for the compassion, support, and understanding you need. Join a support group. Get help at school if you or your child has mental illness that affects learning, find out what plans and programs might help. So we want to talk about how to diagnose mental health conditions. Mental health conditions are treatable and improvement is possible. Many people with mental health conditions run to full functioning. Some mental illness is preventable. It's not always clear when a problem with mood or thinking has become serious enough to be a mental health concern. It means some people don't know exactly when should I seek help, when should I go to a professional. So sometimes, for example, a depressed mood is normal, such as when a person experiences a loss of a loved one. But if that depressed mood continues to cause distress or gets in the way of normal functioning, the person may benefit from professional help or care. Family or friends may recognize changes or problems that a person doesn't see in themselves. Some mental illnesses can be related or mimic medical conditions. For example, depressive symptoms can relate to a thyroid condition. Therefore, a mental health diagnosis typically involves a full evaluation, including a physical exam, some blood work, and also neurological tests. Usually, this happens during the first visit. People of diverse cultures and backgrounds may express mental health conditions differently. For example, some are more likely to come to the healthcare professional with complaints of physical symptoms that are caused by a mental health conditions. And actually, we see this frequently in the clinics. People come with unexplained body complaints or problems like headaches or stomach problems. And when we investigate them, everything organic or medical is normal. And after more investigation, we find out that the cause is psychological stress or psychological problems. Stigma around mental illness and the treatment prevents many people from seeking needed treatment. So what are treatments and how to self-help? Treatment takes into consideration how severe the symptoms and how much symptoms cause distress and affect daily living. The risks and the benefits of available treatments and other factors, for example, psychiatric symptoms complicating other illness. Mental health treatment is based upon individualized plan developed collaboratively with a mental health clinician and an individual and the family member if the individual desires. It may include psychotherapy, which is talk therapy, and the medications. So there is a comprehensive plan including multiple items. This is the usually the treatment plan. Often a combination of therapy and the medication is most effective. Self-help and support can be very important to an individual's coping, recovery, and well-being. Lifestyle changes such as good nutrition, exercise, adequate sleep can support mental health and recovery. A comprehensive treatment plan may include individual actions, for example, lifestyle changes, support groups, exercise that enhance recovery and well-being. Psychiatrists and other mental health clinicians help individuals and families understand mental illness and what they can do to control or cope with symptoms in order to improve health, wellness, and function. There are some ways to maintain positive mental health include getting professional help if you need it, connecting with others, staying positive, getting physically active, helping others, getting enough sleep. And for many, professional help is an important or essential step on the road of recovery. Finally, here is the hopeful message. Stress, anxiety, and depression are universal human experiences. No matter how you experience these feelings or disorders, know that you can seek professional help and you are not alone. That's the end.
So,
Thank you.
So Doc, we have few questions on the Q&A. I can read out for you to answer. The first question is about adult ADHD. What are the common symptoms? We usually connect ADHD with kids, but can it be the disease affect the adults as well? How does it happen?
Yeah, usually it is diagnosed during childhood. That's right, by multiple symptoms like the school complains about the behavior of child. He is not concentrating, more hyperactive, and it should be in more than one setting, not only in school. It's also with in home as well. And there is some criteria for diagnosis of ADHD, like being impulsive, forgetting your things. And if it's treated during childhood or you started early treatment, it has good prognosis, and usually by time, symptoms by growing or by time, symptoms improve, especially hyperactivity become less, and may be the impairment in concentration or less concentration may continue as an adult. So yes, it can continue to the adult person, and they will have the same symptoms as a child, but mainly it will be in the impairment of concentration, but sometimes also with hyperactivity. And there is treatment, there is medications. It has very good results, and many of them improve on medications.
Next question is again related to ADHD. What are the quick tips to manage a child at home with ADHD? Like when there are minor symptoms where the psychologist or the psychiatrist may say it is very minute, he may want to action something at home, can be managed at home. What are things which should be done?
Mm-hmm. The main treatment is the medication. We call them stimulants. This is the main treatment. But yes, there is some no specific steps can be done in home to reduce the ADHD. But just general advice, like other children, they should eat healthy. The mother should notice if there is some food or some things affect her kid. She notice if he, like, for example, eats sugar or sweets or some fast food make him more hyperactive. She noticed this and can reduce this, but there is no specific like other treating like other kids. The medication helps them to sleep well, and also, as I mentioned, they can get away from much sweets and food that has preservatives, because there were some opinions saying that this might increase the hyperactivity. So it's about the caregiver or the mother try to notice what stimulate the symptoms and try to reduce it. Okay.
The next question is, if I feel like I have to talk to someone about my mental health, and I feel like my family or friends wouldn't understand me, what do I do in such instances?
If she want to talk to someone from mental health team and her family, what?
So basically, Doc, the person tells that sh he or she wants to talk to someone about his or her mental health, but she feels that the family or friends wouldn't understand me. What should I do? I think you answered the question during the start of this session, that the right person to go is always a mental health specialist, which is a psychiatrist to start with, who will be able to analyze whether this is related to your mental condition, or it could be something which is just a temporary time period thought process, and then accordingly diagnosis will be established, and accordingly the doctor may ask you to manage it yourself, or a counseling or a medicine. So yes, the next step for you is to meet a psychiatrist
Yeah,
of your preference.
yeah, to
Doc,
seek.
did I answer this question?
Yeah, that's right. To seek help and to not struggle by yourself, to not suffer by yourself. There is why there is available treatments, or there are available people can help, can support. There are many ways. So don't suffer alone, or don't struggle alone. Don't. It's not about weakness. Don't tell yourself I am weak. I have to. For example, if it is depression or something, some people consider this as a weakness, but actually it isn't. It's like we mentioned in the presentation. It's like other disease, medical disease. Like diabetes, or it's about neurotransmitters in the brain. That's what the science discovered. And there is ways, many ways for help and treatment and support. So why should I suffer alone? Okay.
Absolutely. And to also add that nowadays in the market there is something called MHFA, which is Mental Health First Aid Program, which is it's where corporates are training their one or two employees as a helping desk, just for employees to discuss with someone with full confidentiality, and accordingly, because they are not fully trained as a psychiatrist, they will not be able to give you a counseling or anything. They can hear you out, they can guide you to the question which you asked, that please go ahead with a psychiatrist consultation. Yeah.
Yeah.
So again, it worth having a such trained person for you to route to the right personnel to intervene for your condition.
Yeah, this
Going
is
on to the next question. Sorry, Doc, you were telling something.
no, this is excellent what you are saying.
Doc, going on to the next question, can sleeping disorder be sign of a mental disease?
Can sleeping disorder?
Be a sign of mental disease?
Mhm. So sleeping disorders are this is a wide range. If they mean insomnia or inability, difficulty in sleeping, it can be no, yeah, it can be primary. We divide it into primary or secondary. So there is primary insomnia, which means problem in sleeping, and maybe the cause is unknown. And there is, yes, secondary. It might be secondary due to anxiety, to depression, to medical condition in the body. So it's not necessary to be a sign of mental disorder.
Yeah, exactly. So here I think the right person to go to start with is an internal medicine doctor. If bases all the findings, the doctor may not be able to find any physical problems after your
Mhm.
baseline bloods and everything, then maybe you can look at with your consultation with a psychiatrist to overrule that it could be something related to
Yes,
psychiatry. So yeah, to start with, you may want to first consult your internal medicine doctor.
or
Going on to the
GP.
next, yeah, absolutely. Doc, going on to the next question. My mom had depression since 2015 and she refused to get medical treatment. And she thinks that only mad people need psychotherapy. Uh, I want to add this. Unfortunately, this is a dilemma of mental health where people are still not able to come out that mental of a nature that mental health is something different. It's as equal as how you have a physical illness. It's
Mhm.
same as mental illness. Doc, would you like to add something on this? Because it's a very important topic. That is the reason we want to create awareness on mental health. We bring in specialists whose appointments are absolutely busy so that we make people aware that how important mental health is.
Yeah, she mentioned the mother has depression.
Yeah, in since 2015, and it's almost 7 years, she has not taken any kind of a treatment. She refuses. It is her understanding that only mad people need psychotherapy.
Mhm, mhm. Yeah, this is very difficult. That's what we call the insight. The person should have insight, or when he has insight that he needs help, the prognosis or recovery is better. But people in denial that they don't have any problem, usually, yes, it will be difficult. So that's yes, as you mentioned, that's why we try to promote that mental illness, depression. It's much pretty, it's so common these days. Depression and anxiety, obsessions, due to lots of stressors, and it is improving. The stigma about it is improving. As I mentioned, celebrities started to talk about it, and we started to mention that mental illness is no shame about it. It's when you are suffering from depression. It's like when you suffer from head headache, you go and take Panadol. So it's the same.
Absolutely. So, Doc, in order to answer this question, because I'm sure a lot of people might have this problem, either with family members, with spouses, maybe for parents, for children. Do you think that to start with, when there is a person depressed in at home, is there a specific arrangement we can make at home to make it a little livelier for them so that they come out of that depression, they are able to understand that yes, there is something wrong with me, and they may want to do a psychotherapy. So at home, is there any specific arrangement or any kind of environment which can be created to reduce the depression symptoms? Or I would say, is there any self-help available for depression?
Yeah, but because this is a big question, we are talking about how to convince the person to seek professional help, or how to help him without.
Yeah, to start with, my question is, Doc, when there is a depressed person, or if, let's say, if ourselves are depressed, what kind of family atmosphere should we create at home that the symptoms are less frequent, or we alleviate the symptoms? What do we do? What are the self-help
Yeah,
uh,
there are
tools?
some advice like um, support is very important. You tell them that I am here to hear you or to listen to you. I'm here to help. Um, don't. Some people comment like you have to be stronger. You have to. I have been through like this, and I beat this. Don't show them that they are weak. No, instead of this, you have to watch your language.
Okay.
Okay.
It's how we talk to them. It's important how
Yeah.
we
It is.
have to show that we extend our support instead of being telling them that why are you doing this, or um, you have to be stronger, you have to handle situation. It
That
it's
would.
like
Yeah.
exactly. So we have to, it's like the first line of help is to stand as a, support for the person. That is the reason doctor initially told in one of her slides, support groups are most important. By support groups, we mean that like diagnosis, like when you interact with people with similar diagnosis.
Yeah.
Uh, so what you can actually do is whichever doctor you are consulting at any hospital, you may ask the hospital or the doctor if they have a community, a depression community or a similar condition. So
Mhm.
they will give you a quick fix. So yes, support is the first line of management or self-help for this.
Yeah. That's.
Doc, our next question is, I want to know if there is something to do where without a doctor or a medicine.
To keep you in good mental health, you mean?
Yes, yes.
Yes, it's the general advice. Usually to try to think positive, get enough sleep, eat healthy, do some also physical exercise is has a good impact on our mental health. Uh, uh, keep social, keep being social and surrounded by the loved ones. It's like that.
It's a very, like doctor said, I think quick fixes, which there are certain things which we may want to enjoy, for example, sports, meditation, yoga.
Yeah,
Rightly said, doctor said to keep yourself active because there are researches which proves that physical activity helps in mental health. So these are very quick fixes, yes, but like doctor said before, it's important that whenever you see any symptoms, have a consultation. What,
exactly.
okay. Next is, doc, what is the difference between psychiatrist, psychologist, and therapist? How does one choose? whom to go based on the symptoms?
Hmm. Usually they can go, most of the patients came as a referred from the GP usually. So the GP is the primary, the general practitioner, and then he can refer the patient to the psychiatrist. And the difference between psychiatrist and psychologist, we work together. Psychiatrist is a medical doctor. He is graduated from the medical school, and he or she, they usually studied psychiatry, and as well neurology, and they can prescribe medications and ask for lab investigations, and they can admit some cases in hospital and follow up them. This is for a psychiatrist. Psychiatrist is a physician, a medical doctor, but psychologist, they are not graduated from medical college or school, and they studied psychology, and they give a wide range of treatment. It's called psychotherapy or talk therapy. So they give treatment by talking, or
Counseling.
yes,
Counseling.
they teach their patients some techniques to how to overcome the problems. So usually we work together. Some patients take medication from psychiatrist and follow up psychology or therapy sessions with the psychologist or therapist. They are quite similar.
Yeah, so to make it simpler to understand, it's similar to how you have orthopedic doctor who prescribes physiotherapy. So
Yeah,
orthopedic doctor is a doctor who
yeah,
can prescribe medicines and who can treat you, do your surgery and everything.
yeah,
That is similar to a psychiatrist. They are a doctor. They can prescribe your medicine. If the symptoms are very bad, like doctor said, they can admit you, they can treat you, give you injections, they can do everything.
yeah.
One part of the treatment for mental conditions is counseling.
Mm,
That is what psychologists do. They give counseling sessions. Now, there is a lot of practice where people actually go directly to a psychologist. I
mm,
would not personally recommend that because you may need a specialist to diagnose what is your condition. Is it a OCD? Is it a depression? Is it psychosis? You need to have the condition. Without that, just going to a counseling would not help. It would be possible that you may have a OCD, which needs medicines. Without medicines, you may not be healed. Counseling will be just part of it. So you go ahead with 50, 100 sessions, your condition will remain as is. So yeah, that is the difference. Now
and
you
yeah,
have
some
also
people.
added therapist. I do not see a difference between a psychologist and a therapist. Yes, in the market, there are a lot of new techniques and everything, but it's not usually available in the hospitals. The two modular available is psychiatrist and a psychologist.
Yeah,
Sorry, doc, I interrupted you.
no. That's totally right. I agree with you. And some people, they might have fear of medications, and they prefer to start with therapy or talking therapy. But usually, the psychotherapy, if it is alone, it will take more time to get the results than medication. Medication is much or quicker or faster in their results, and also some disorders, yes, need medications, and also we need also to raise awareness that because there is concept among many people that psychiatry medications cause addiction or I will be used on it. So this big misunderstanding. The psychiatry medications currently they are advanced and safe and effective, and they are not addictive. So we have to also educate about this. Okay.
Absolutely. Yeah. Doc, there is a last question which we may want to pick. Yeah. I do not know if you want to pick up this question. Is epilepsy transmitted to children from parents? It's not related to psychiatry. Epilepsy is a neurotic condition. So I may want to pick up this question. Epilepsy is a neurotic condition. Yes, there are some genetic transmission done from parents to children. However, it is not contagious,
Yes.
but you may want to do your genetic testing, or it's possible through genes, but not contagious.
Yeah. Yeah.
Again, a neurologist will be able to explain more on this. Dr. Nadia is a psychiatrist, and it's not related to psychiatry. Thank you so much, Dr. Nadia. We may want to wait for another 2 minutes for any more question, and we can wind up the session. Thank you so much. It was a very informative session. Thank you
Thank you.
so much for joining the session.
It was
Thanks
my
everyone for joining the session.